Hello, my name's Chris Sutton. I'm a consultant upper GI surgeon. I'm based here at the Woodland Hospital. My main interests are upper GI reflux surgery, so that's surgery for heartburn. We offer lots of different treatments. From the diagnostic perspective, we offer endoscopy and barium studies, and then from the surgical perspective, we offer the 3 different types of wrap surgery or fundoplication for reflux. We also offer an endoscopic treatment called Stretta, so that's a non-surgical option. And we offer a newer procedure called link surgery. That's where a ring of magnets is placed around the lower part of the esophagus to augment or help the muscle at the lower part of the esophagus to stop acid entering the esophagus and causing patients heartburn and ulceration. 20% of the population have heartburn symptoms. The patients that we worry about are the patients that have persistent symptoms. So heartburn is when acid is moving from the stomach to the gullet or the esophagus, and it's literally burning the inside of the esophagus and causing pain. It's completely normal for the esophagus to have a small amount of acid in it for a small amount of the time during the day. And a proportion of the population simply are aware that that is going on and they have an acid-sensitive esophagus. In that group, surgery is not the right option. The group that we need to think about surgery are people who have acid in their esophagus for quite a long period of time. And the worry with that group is that you can get ulcers or strictures. The cells in the esophagus can change from one type to another, and the cells that they can change into are unstable. That process is called Barrett's esophagus, and a proportion of people with Barrett's esophagus do develop esophageal cancer. So without wanting to scare people, if they have persistent heartburn, it's always important to have that investigated. The surgical treatments can be done keyhole or even endoscopically. The endoscopic treatment is a procedure called Stretta. So the patient goes off to sleep for half an hour and a special device is placed in the gullet, and little needles are placed into the wall of the gullet, and energy is delivered to tone up or bulk up the lower part of the esophagus to prevent acid coming up from the stomach into the esophagus. If one has symptoms, we would start off with an endoscopy. We would follow that with either an X-ray swallow test, a barium study, and then go on to do the pH study. All of these are part of the journey before we would think about surgery.